Hello, everyone. My name is John Immel, and today we're going to talk about tongue assessment, a fascinating subject. I think of tongue assessment as one of the most useful assessment tools in Ayurveda for many reasons, and one of them just simply being that you can take a picture of the tongue and then analyze it, and you can even sit down with the client after taking a picture and analyze it. And you can't do that with some of the other assessment tools like pulse, for example. You can't take a picture of the pulse, and also the tongue is such a great window into the digestive tract. It's a part of the digestive tract, and so it is helpful to have a part of the digestive tract that is visible. Great, and someone is mentioning in the chat here that that's quite a photo of the tongue in this presentation. You can see here a crack. Tongue has many deep cracks in it, and I think that's more advanced pathology than what I typically see. But I do see this in the clinic. This kind of tongue, and it does point to some degenerative issues in the digestive tract and also some dryness. But we'll get to cracks on the tongue a bit later, and so let's get going. This is what I look like. My name is John Immel. I'm the director and founder of the Joyful Belly School of Ayurveda. Today's talk is sponsored by our 2-year program certification course, The Fundamentals of Ayurvedic Medicine. And our program is entirely online. There's no travel required for you to earn your Ayurveda certification and begin practicing and seeing clients and offer the kinds of things that I'm going to discuss today. In a way, today's conversation is a kind of um, example or a little taste of what our students get. Now, our students get more information about the tongue than I'll present today, and of course, over the 2 years, it's pretty extensive program, uh, an intense program, and we welcome those students who want to be clinicians to study Ayurveda and know it through and through, which will be very helpful for you in feeling good throughout your life and really being able to monitor your body. I contracted COVID about a month ago and used Ayurveda to monitor my health and to keep tweaking my body and take care of weaknesses and other things like that. And I got through it relatively painlessly. And I think Ayurveda can help many people with any kind of condition that they're having to support their body through any illness. And so part of what we'll learn today is the assessment part. Tongue is about assessment. So so it's not necessarily about treatment, but about figuring out what's going on in your body, and that's a really important Ayurvedic part of the Ayurvedic process. Is you have to know before you can respond. And so tongue is one of the most important tools, and we'll jump into some of the aspects of tongue. The tongue, as I mentioned earlier, is a visible part of the digestive tract, so it's a window into the digestive tract. What happens on the tongue is happening in the GI tract. So if you eat a hot chili and the chili is very spicy, it's going to be hot in your GI tract as well. And you may even feel the heat in your elimination the next day. So what happens in the GI kind of also happens on the tongue. So if you have inflammation in your GI, you might see signs of that on the tongue itself. I think of tongue assessment as looking down, peering from the opposite side of a periscope, right? Looking down the periscope into the submarine. Normally, the submarine puts the periscope up and looks out into the world, but with tongue assessment, you're kind of looking down the periscope into the submarine, into the deeper organs of the body, and that is very helpful. So, the tongue is a gatekeeper, right? It's a gatekeeper and a gateway into the GI tract. Nothing passes into your GI tract without the tongue's approval. So if something tastes terrible and you don't want to eat it, the tongue is, in a way, participates and is part of your sensory organs and your decision-making process around what you eat. And that, because the tongue is a sensory organ, problems on the tongue affect your decisions about food. If you have, going back to this COVID example, I had coronavirus about a month ago, and I lost all sense of taste and smell, and it was very difficult to choose the right foods for my body. And I noticed that, I was having to use all of my Ayurvedic knowledge instead of just my taste to discover what to eat. And it was very difficult, even as a practitioner, to know what to eat without my senses. So other things can distort taste on your tongue and lead to incorrect food cravings. A coating on your tongue, bad breath, even can all distort taste. And so what we want to do is keep our senses strong in our body. All of our sense organs, we want them to be in tip-top shape so that it helps us make great decisions in our life. All right, tongue assessment is basically subacute. So a pulse assessment will show immediate changes. If a person's hungry, the pulse will be distorted. But if you're hungry, your tongue won't be distorted. If a person's very anxious in the moment, you'll be able to feel that in their pulse. But it's not going to change their tongue so quickly. Maybe the tongue will be a little bit more jittery if the client is nervous, but otherwise, it doesn't have as dramatic an effect or as quick as effect on the tongue. So the tongue's surface changes somewhat daily and weekly, but not minute to minute. So it's a useful sort of intermediate assessment tool. It kind of is reliable for what's been happening over the last week or so. Tongue color can reflect more chronic condition. The tongue surface more like a weekly condition. Tongue color, chronic conditions, and the tongue shape is more constitutional and something that you have throughout your life. So tongue shape doesn't change that much. Slowly over time, over years and years at night. Okay? I went through most of this already, but I'll say that the tongue shows the condition of your fluids really nicely. It will show excess and deficiency and toxins. It also shows the strength of your Agni or your fire, your metabolism, and your temperature, the strength of the client. The tongue shows that very well. And the tongue responds really well when a person's body starts to get in balance. You can see it on their tongue. So when I'm meeting with a client, and if I meet with a client 4 or 5 sessions, I'm looking to see that improvement on the tongue as the sign that we're on the right track. And if I don't see that with the client, then I'm thinking, well, maybe we need to change our strategy and try a different angle. All right, I want to talk about the 3 levels of awareness of a practitioner as we're leading into the specifics on the tongue. Our goal, right, is to use these assessment tools to interpret what's happening in the entire body. So we're looking at a small area on the tongue and using inference to figure out what's happening in the rest of the body. So there are 3 levels of awareness of a practitioner. One is, if you know the client's whole body, you can see how a part of the body relates to that. So if you're looking at a patch of skin, you know the client well, you can see how the client's imbalances are reflected in the patch of skin. The other way around is the ability to look at the patch of skin and see what's happening in the client's whole body, right? And that's level 2. So in this case, what we're aiming for is excellent understanding of the tongue, that we would be able to understand the whole body just given the tongue, right? And a higher level of awareness of a practitioner is when they can understand the nature of the client. Now, the nature of the client is, is on some level inaccessible, right? Incredibly deep. You'd have to, only no, you can never know a whole person, right? But an expert practitioner can get some key key understandings or the essential things about the client's nature, so that they can reach and connect into the heart of the client and inspire them to move in the right direction to heal themselves. So that's the next level. We won't be getting into level 3 today, but we're going to be in level 2. How do we assess the whole body given a small part of the body? We'll talk about what to look for on the tongue, how to interpret tongue signs, and also we're going to back up whatever we learn on the tongue. Ultimately, we're going to back it up through the rest of understanding the rest of the client's body. So we're going, as a practitioner, I never rely on one diagnostic tool, but if I see a strong sign on the tongue, then I'll see if I notice those same signs in the skin, or notice those same signs in other parts of the body, and I'm going to correlate them. I'm not just going to see one sign in one place and then be overconfident. Great. So I talked a little bit about just the kind of preliminaries here. I want to give a brief overview of the anatomy of the tongue, and you can see here a picture of the tongue, and there's a bunch of different structures here. One, we have different kinds of papilla. Some papillas have taste buds in them, especially at the tip. And then you see here these foliate papilla, or the fungiform papilla at the tip. They have more taste buds. Then there's these filiform papilla, which is more in the middle of the tongue, and that gives your tongue a kind of sandpapery surface to it. And you can feel that right now in your mouth. If you rub your mouth, your tongue on the roof of your mouth, you can kind of feel there's a bit of roughness. Those are the filiform papillae. A cat's tongue is really rough. So this filiform papillae help with the tongue, you having a scraping function, cleaning your teeth, things like that, cleaning your mouth out. And it also helps in some other areas too. And then we have these other forms of papilla and other structures here. I'm not going to get too into that here. So when we're assessing the tongue, by the way, we're going to start by looking at the whole area, right? So I'm going to look at the skin around the lips, then I'm going to look at the lips, then I'm going to look at the teeth, then I'm going to look at the back of the throat, and then moving in, I'm going to look at the tongue surface and what's on the tongue surface, coating on the tongue, and then the tongue body and the tongue color. And in general, in Ayurveda assessment, I always go top to bottom, outside to center, and surface in down deeper. And that's just the way I do it. So I always am assessing things in the same order every time, so it's comprehensive. On the tongue, look at all this stuff that we can look at in the tongue. We're just looking at it, in a sense, we're just looking at the tongue, but we're finding out all this other information. And you can see this whole list here. Some stuff I didn't even mention, like musculature, engagement of the tongue, saliva, all of that is part of the tongue assessment. Also, I want to mention, when you're looking at the tongue, remember how the ambient lighting is affecting the photo or even the live visual appearance of the tongue. So you want, you want good lighting, and make sure that the lighting isn't distorting the appearance of the tongue. Make sure your client doesn't use a tongue scraper the morning of the assessment of the tongue, because that's going to distort the tongue. And And the client should present their tongue in a relaxed manner. Also recognize that if the client has recently drank coffee or eaten food with turmeric, that can change the color of the tongue to brown or yellow, or sucking on sweets can make the tongue surface red. And so just some preliminary things. Let's look at a normal tongue. Normally, when you look at a tongue, one, the breath should have no smell. The lips should be red to pink. There should be no sores or yellow color in the throat. The teeth should be white like a pearl, not grayish or yellowish. In Ayurveda, if a person has gray teeth, that's vata ama in the colon. And if it's yellow, it could be bile components in blood, which is pitta. If any one of you know what those dosha means. But this is a picture of a pretty healthy tongue, a little pale. No one has a perfect tongue. There's a little bit of paleness here, but otherwise pretty good tongue. No cracks on the tongue, and generally a good healthy pink color. The saliva should not be too thick or stringy, and the tongue should not look too rough or too dry either. There should be no bubbles on the surface of the tongue. If you see bubbles on the surface of the person's tongue, it means their saliva is too thick. There should be a nickel-sized, very thin coating in the back. So everyone should have a little bit of coating. If there's no coating in the back, it means that they are deficient, and also or too hot, so that they're burning off their fluids. And hold on one second here. I just heard some background noise, so I'm just gonna click that mute. And I see someone's drawing on the screen here, so let me clear that. Hold on. There we go. Okay, great. So there should be 2 bumps on the back of your tongue on either side. Although not everybody has that, it's not abnormal if you don't. But it's also not abnormal if you have them. Some people look at their tongue in the mirror and see 2 bumps in the back, and they freak out. But nope, that's normal. It's okay. They're just papilla, bit large papilla. The underside of your tongue should also have pink color, and the veins should not be distended on the back. The shape of a normal tongue should be a flat U, not a V. The tongue shouldn't be too swollen, shouldn't be too thin. The tongue should be relaxed and still, but have good tone. Not be a blob, or not limp, not very limp, or not curled up, or not very stiff. And it should be pink like a watermelon or fresh pork. All right, you may see a little bit of a slight redness at the tip of the tongue. Let's see if we notice it here. And we do. Notice the tip of the tongue is a little bit more red. That's a sign of healthy Agni, not a sign of excess heat. So that little bit of redness on the tongue, we should expect it. If it's not there, it's a sign of too much coldness. All right, we're moving fast, but we have a lot to cover. So I'm going to keep on marching forward and talk about saliva, because that's one of the things we're assessing on the tongue. We're always paying close attention to fluids in Ayurveda, because that's what all your organs are sitting in, right? Your lymph, your blood. And so we're looking at whatever visible fluids we can to try to get at what the internal fluids of the body are like. So, so if the saliva is too thin, the tongue is going to appear rough and dry. And that's a sign of dehydration, or fluids are deficient in macronutrients, right? You want your blood to be rich in fats and sugars, not overly rich, but not deficient either. So if the tongue appears rough or dry, that may mean the saliva is thin and a little bit deficient or dehydrated. It can indicate thin mucosal membranes in the GI tract. So we want a good healthy mucus in the GI tract to protect our digestive organs. If you have very thin mucosa, then your acids in your stomach are going to irritate the lining of your stomach. So we always want to make sure that we have good healthy mucosa. If the saliva is very thick, then the saliva will feel slimy in the tongue, or you may notice a string of saliva uh, from the roof, from the tongue to the roof of the mouth. So when I ask a client to show me their tongue, if I see a string from the top to the bottom of the, excuse me, from the roof of the mouth to the tongue, then I know their saliva is very thick. And that means that there's too much fats, sugars, and proteins in the blood. That there's too much richness in the blood, or what Chinese medicine would call dampness. Or it could be a sign of extreme dehydration. All right, let's talk about the coating on the tongue. Now, the coating on the tongue refers to material that's on the tongue, but it's not the saliva. It's kind of stuck to the surface of the tongue. Here's an example of a coating. You can see a white coating stuck to the tongue. That's not saliva. You see the saliva in the tip here. But the coating is something that's stuck onto the surface. And the tongue coating is going to show us whether there is toxins or ama or a general excess in the bodily fluids. And what is that coating made of? The coating is made of dead bacteria, actually called trub. Now, if you ever made homemade wine, which is a really fun thing to do, you can make honey wine at home or with some other fruit. Grapes is the traditional one, but you can make apple wine, which is apple cider, really, or pear wine, which is pear cider, and other fruits. Anyway, when you make wine at home, what you see is all the yeast forms a kind of trub at the bottom of the bottle, and it may be this layer of dead yeast that's like 2 inches thick, and that's basically what your tongue coating is. It is the bacteria that are dead. And why are there so many dead bacteria on the tongue? Well, when the saliva is sweet and the tongue and bodily fluids are very rich, the bacteria love it, and so more of them grow, and so you get more dead ones, and that's what makes the coating. All right. So when we see a strong coating on the tongue, we are thinking that it's a sign of excess, too much richness, or ama, or toxicity in the body. All right, so you can scrape off the coating with a tongue scraper, and that's a good thing to do, but not before your practitioner is assessing you. All right. Now, there's some controversy about the size of the coating on the tongue. In yoga spirituality, the yogis try to have a completely clean tongue without any coating at all. And that's because the yoga vision of purity is very ethereal. Ayurveda, on the other hand, aims for wholesomeness. So I just want to clear this up because I know there's a lot of people out there who are listening on this call that are that may be thinking they should totally get rid of their coating on the tongue. And that's yoga, not Ayurveda. In Ayurveda, we aim for wholesomeness, not ethereal, not being ethereal. And so a nickel-sized coating in the back of the tongue is best. And that small coating is a sign that the blood is adequately sweetened so that you can, you'll be stable. If you're deficient, your health will be unstable. All right, this a thick white coating like this is a sign of excess. As I've mentioned, it can also be a sign of kapha. A little small bit of white coating is normal, but a thick coating like that is too much. If the coating is gray, as in this photo, that points to toxins in the colon and turbidity. It points to poor elimination. If I see this in a photo, I'm thinking that their elimination might not be so good. And I hear some background noise, so I'm just going to mute those lines again. The grayness can be due to candida outbreak in the body. And if you have a gray coating on your tongue, it generally smells or tastes bad. It'll cause bad breath. Sometimes the coating is yellow. And when the coating's like this, yellow like this, And it doesn't have to be this intense, by the way. You can look at your tongue coating and see a very mild yellow tongue coating. But it points to the presence of bile components in the blood, which points to a stressed liver. Now, when I again a few weeks ago, when I had coronavirus for 5 days, I noticed that I started to get a thick coating on the back of my tongue, and it was slightly yellow. So I knew that my liver was a little bit aggravated, and I took some bitter herbs to correct that and support my body. All right, a dark brown coating like this is more unusual, and I see that as a strong Vata sign, and a little bit severe too. Like this is something that I would see alarming. It would be alarming if I saw a coating like this. Now, sometimes it happens after a very stressful event. Your tongue might look like this for one day, but and then it goes away. So then I wouldn't necessarily be very alarmed. But otherwise, this kind of dark coating like this, I would consider to be alarming. After drinking coffee, your coating on your tongue can be slightly brown, but it won't look this brown. All right, and now on this photo of a tongue, pretty healthy tongue here, some superficial cracks. We see some red spots. I would like to see those, then the client not have that. And we've got a little coating in the back, a little bit of depression too. You see how the tongue is sort of like, there's a depression in the center of the tongue in the back. So that's not quite that good. I mean, this person probably like 15 years earlier had a perfect tongue, but as they're aging, the tongue is getting a little deflated in the back, some superficial cracks, some heat signs as well. And that's all, natural aging signs. But this kind of coating in the back is what I would consider to be a healthy coating, or the perfect kind of coating. This, again, is a really thick coating, which is a sign of ama. And this is really typical. Now, notice on the sides of the tongue, we're seeing a deep red color. And that red color is showing lots of heat. So we see a heat sign as well as a very thick coating like this. So this person probably needs to really clean up their diet. And I bet once once their blood's a little cleared out, the heat will go away on its own. All right, sometimes the coating is a sort of white and yellow mix, as on this tongue. This is a thin, greasy coating. You can see that when the white and yellow coating mix, it resembles grease. And this kind of coating is often a little bit creamy, sticky, and dry. This tongue is a little bit pale, in addition to having this sort of greasy yellow coating on it. And when you see the yellow, you're seeing a heat sign, maybe some inflammation in the body somewhere, or stress on the liver. And then the white coating, or the thickness of the coating, points to that dampness or excess. Sometimes you see that the coating is very patchy, and there are sections of the tongue where there's no coating at all. And that's called a geographic tongue. In Ayurveda, that's a sign of parasites. But in Chinese medicine, that's just simply a sign of deficiency and dryness. To me, when I see a lack of evenness in the coating like this, I assume the doshas are acutely aggravated. There's an acute imbalance. Now, here's what I would call an old or tofu coating. You see it's very thick, and it's almost like you could scrape it off in chunks. And when I see this, I think of something like cracked, dried mud. So there is excess in the fluids, but also dryness at the same time. And this dirty yellow coating implies pitta ama, or stressed liver, and or heat or inflammation in the body. This is a tongue with no coating on it at all whatsoever. Now, you can't exactly see into the back. Maybe there's a little coating there, but otherwise, there's almost no coating on this tongue. And I associate that with depletion. And it's usually depletion due to heat. Usually I see this in clients who like to drink alcohol. and they're young and their body can kind of handle it. As they get older, the liver starts to degenerate, and you start to see the yellow coating on the tongue, and the metabolism will start to become more deficient. But in this healthy younger person, they can get away with the alcohol creating that extra heat. Or if a person smokes tobacco, it just creates so much heat that it'll burn off all the excess in the blood. Whenever I see a no coating on the tongue, it usually you can see there's a sparkle in the eye, a brightness to the face, but it's like a shooting star. It's that brightness that soon fades or burns off, leaving deficiency in its wake and premature aging. So that brightness looks good while it lasts, but doesn't last very long. And so when do I see this? I see it in alcoholics, but I also see it in people who try to eat a very perfect diet, like a very clean yogic diet, where they're just not eating enough calories and trying to eat very, very pure foods, but not nourishing themselves enough. You can see this as well. Excuse me. Here's a deep red tongue without a coating, and this I think of as more like tobacco or something that creates a lot of heat. Tobacco is pretty hot, pretty acrid, actually. All right. So now we've moved from what's on top of the tongue to the surface of the tongue itself, right? I always said we go outside in, right? Top down, outside in, and then towards the center surface, towards the deep tissue. All right. So it's normal to have some those two papillae in the back of the tongue or some fine red dots at the tip. But if you have scallops on the edge of your tongue like this, it can mean that, excuse me, that you're pushing your tongue up against your teeth, or that your tongue is swollen. In this case, this tongue looks pretty swollen. And there are various reasons why a tongue might be swollen. In Chinese medicine, it's considered to be lack of fluid transport by the spleen, which is a fancy way of saying low agni. This tongue surface has no papillae on it, right?
God.
None of the taste buds on it. And I'm hearing some background noise there. I'm just going to mute those lines, and I'll check in the chat. Can I make sure everyone can still? Okay, great. I do see someone saying, "Can we get the presentation slide?" Everyone can see the slides, right? That I'm using, because I think the slides are pretty key. Just chat in. Yes, good. Okay. Sometimes I've noticed with Zoom that the slides will suddenly get stuck, and you'll stop seeing them. And if that happens, just put it in the chat and let me know, and I'll try to correct it. Okay.
I think the question is like, can we get them after the presentation is over?
Oh yeah, no, I'm not going to send out the presentation slides. I appreciate that. I can appreciate that. The slides are really nice to have, and our students in our program do get transcripts of all our presentations, so that they have all that information. Great. So when you have a smooth surface of the tongue like this, it reflects a severe deficiency in the person's body, and usually you see this in an older person. It'd be very unusual for a young kid, for example, to have this. Often, when the tongue is deep papillated and shiny like this, it's a deep red, as in this case, and that is a sign of more advanced conditions. If it's pale and depapillated, pale always is a sign of blood deficiency. All right, big red spots on the tongue like this, to me, are acute aggravation of doshas. Happens before you get sick. So it's a heat sign. The bigger, the redder, and the more raised the spots are, the more heat there is. So if a person's coming down with a cold, you may see this the day before. Notice also this sort of thick greasy coating in the back of the tongue as well. So for this client, probably coming down with a cold or some infection, and the core imbalance in their body is in excess because of this thick coating in the tongue. So I would tell them probably to eat some fresh greens with very little calories for a day or two, and see if that doesn't clear out the excess in their blood, and that will help avert them from getting sick. All right. So Western medicine, these red spots can also be a sign of food allergies or folate deficiency. All right, normal tongue about cracks. Normal tongue should have no cracks, like this tongue, which I presented earlier. A crackless tongue is a tongue that's well moistened. Means that the person is hydrated and has good circulation, and that their plasma is nourished, well nourished. When a person has cracks, it's a sign of deficiency, or the tissues drying out, or degeneration, a loss of substance in the body. Right? So pathology always starts out as a loss of vitality, but then that loss of vitality gradually leads to a loss of substance. Right? Think of this like a aging lion is a predator, but they don't have enough strength to catch the prey anymore, so that they lose substance. So that lack of vitality eventually causes loss of substance. And that is just a general progression of things. So, so first we'll see a loss of vitality. Maybe the tongue's a little pale or a little swollen, but eventually that leads to dryness and a loss of moisture. And cracks imply that loss of ability to moisturize the body. That's vata. So kids rarely have cracks. And adults frequently do have cracks that get deeper and longer and more in number over time. And also, cracks can come and go very quickly. Like a person could have an extremely stressful day, have lots of cracks in their tongue. 2 days later, their tongue may have no cracks. And that does happen. So a single small superficial crack is less significant, but as the cracks get more in number, deeper, and longer, it's more of an imbalance. And cracks are always a sign of injury to fluids. Now, sometimes you get a coating in the crack like this, and that is a sign of acute doshas being aggravated, or what Chinese medicine would say, a kind of wind condition, which is where your body's sort of flaring up, imbalances are flaring up. Okay, location of cracks corresponds to different disorders in the body, but I'm not going to go over all the particulars of that just because of time. This is a fissured tongue, like that tongue, that photo in the cover photo, which is many deep cracks. You have the geographic tongue, where there's many patches on the tongue, and a fissured tongue is where there's many deep cracks. And but most common is you'll see superficial cracks like this on the tongue as a person ages. And it's just a bit of, again, dryness in the body. Here we see pale tongue with cracks. And that is a particularly problem. Remember I said before, loss of vitality with the paleness and loss of substance. So this person's in a pickle because they have a loss of vitality and loss of substance. And then we're seeing accumulation of toxins, these kind of gray toxins. This kind of tongue to me would be a little bit more alarming. Deep, very deep cracks also with redness. So you see here a kind of deep heat condition that's burning off all the coating on the tongue. There's no coating here. Unlike this pale tongue, they don't have enough fire to burn off all those toxins. This person's burning off all the toxins, but there's so much heat here and so much dryness because of the heat that this heat is really injuring their fluids, and I would see this as a bit alarming of the tongue also. Again, all these deep cracked tongues, alarming. If there's cracks and the tongue is shiny and depapillated, that's the worst. Severe dryness. Okay, great. Shape of the tongue. The shape relates to the constitution of the client. And changes in shape often point to more chronic conditions. So let's take a look at. This is a very swollen tongue. So the Agni is low, the body's not moving fluids very well, so there's water retention in the tongue. Notice this tongue is also very pale, and that's what we expect. Because if there was a red tongue, they probably have heat. And if they have enough Agni to have heat, they probably have enough Agni to move fluids. So we expect a swollen tongue to be slightly pale. And the swollen tongue could be due to fluid retention, due to weak kidneys, or the fluids may be hard to circulate because they're too thick and rich. There are several reasons. So we can't just leap to conclusion on weak Agni. It could be thick fluids, could be kidney issues. All right. So tongue can get swollen due to systemic inflammation in the body. If the tongue is very thick, that means it's a very muscular tongue. If it's not swollen and puffy, but has good tone and is thick, it's a muscular tongue. If the tongue is very thin, that points to dryness and points to more vata, a general deficiency person, a lean person. Yeah. All right, this tongue has a depression in the root. And in general, this tongue looks deflated. It's like a balloon that's been deflated. And so this I see as lack of strength, what in Chinese medicine you call loss of essence, loss of ojas, depleted strength are all different ways of saying that. Now you notice here, the tongue is as a sort of dark brown over here, which I would associate with blood stagnation also. And this paleness of this tongue, I mean, this person has pretty severe anemia. I mean, you can't even tell their lips are not even much more red than their mouth. So this to me looks anemic. Here's a very long, narrow V-shaped tongue. That's a very sort of Vata Pitta tongue, where the person has lots of heat. Look at the enthusiasm and the smile, and the tongue is quite engaged and stiff. So you see here a very enthusiastic person, and who can really project their tongue because throughout their life they've had great circulation and thin fluids, which leads to longer limbs and even a longer tongue. Here's a very short tongue. It looks like the client doesn't have enough energy to put even get their own tongue out of their mouth. Severe depression in the root, gray coating, and the tongue looks cold and dark. So this is a person who's, to me, looks very weak. All right, very pointy tip can be a sign of lots of heat drying up the fluids also. All right, tongue body color. As I said before, the normal color of the tongue body should be a pink fleshy color like fresh pork or watermelon with slight redness at the tip. All right, and we talked about pale tongue means blood deficiency. And here's another very pale, swollen, wet, cold tongue. No color here at all. But when the tongue's red like this, we see more heat, and it ends up drying up fluids, which causes more cracks. Right, so these tongues where there's no where there's water retention have no cracks, right? And we're not surprised about that. Pale, swollen, no cracks. But here we have red, dried out, and cracks. This is a very thin tongue here, and it's thin and red. So the heat has dried up the fluids and made the tongue very thin. And we saw this before, deep red tongue. Now this tongue has a very red tip. So that could be a heat flare-up somewhere in their body. When the tongue is bluish or purple, that points to more severe blood stagnation. You know how when kids go swimming in the pool and their lips turn blue because they're cold? Well, that's because the blood is stagnant because of the cold. And that's what the case is for this tongue too. The tongue is turning very kind of bluish or purplish, and it's a sign of poor blood flow and blood stagnation. All right. Great. This has been a brief presentation on tongue diagnosis, sponsored by the Fundamentals of Ayurvedic Medicine 2-year certification program at Joyful Belly. And I'm happy to use up the rest of our time here. We have 10 minutes for conversation and questions, which I'm happy to answer any questions that you might have about our courses, about the tongue, and presentation. I hope that that you have learned a lot from today's talk. And thank you.
Hello, thank you. I have a question.
Yes.